Welcome back, everyone. Today we're diving into a stack of pharmacology notes, and they're all about the gastrointestinal system.
Oh, the GI system.
Yeah, looks like someone's getting ready to explore how our guts work, and of course, all the medications that can help keep them happy.
It's a pretty amazing system, even if it is a little bit gross sometimes.
Oh yeah, definitely.
But we're going to break it all down, right? We'll look at conditions like ulcers and GERD and all the different types of drugs used to treat them.
Exactly, with a special focus on how they actually work, and of course, any nursing considerations.
Right.
So get ready for some fascinating and sometimes slightly icky facts about digestion.
Well, it's going to be fun, but don't worry, we'll make sure it all makes sense, even if you don't have a medical degree.
Right.
So, first things first,
Okay.
your GI tract. It's like this perfectly tuned machine with four main jobs:
Okay.
secretion, digestion, absorption, and motility.
All right, let's break those down a bit. What exactly happens during secretion?
Well, think of it like your body is setting the stage for digestion,
Okay.
releasing all the essential substances, enzymes that break down food, acid to create the right environment, bicarbonate to neutralize things, and mucus to protect the lining of your gut.
So it's like prepping to cook an amazing meal.
Yeah,
You need the right ingredients, the right tools, and a clean surface, right?
exactly. And once everything's prepped, that's when digestion starts.
Uh-huh.
That's where those complex food molecules, they get broken down into smaller, absorbable pieces.
It's like taking apart a Lego structure.
Oh, I like that.
You break it down into the individual bricks so you can build something new.
Perfect analogy. And those individual bricks are then ready for absorption.
Okay.
They pass from your intestines into your bloodstream,
Mm.
ready to be used by your body.
Ah, so that's where those nutrients finally come in, providing fuel for our cells.
Exactly.
What about motility? What's that all about?
Motility is all about movement. Those muscular contractions that move food and waste products through your GI tract.
Yeah.
Think of it like the conveyor belt of your digestive system,
Okay.
keeping things moving along.
I'm starting to see how these four processes are really interconnected, like a well-choreographed dance.
Exactly. And if there's a misstep anywhere in that dance, that's when problems can arise.
Yeah, that makes sense.
Disruptions in secretion can mess up digestion, problems with absorption, well, you might not get all the nutrients you need, and sluggish motility, well, that's when things can get really backed up.
And speaking of backed up, let's talk about one specific condition mentioned in these notes. Peptic ulcer disease, or PUD.
Yeah.
What are the signs you might have this?
Peptic ulcers, they're open sores that develop in the lining of your stomach or the first part of your small intestine, the duodenum.
Oh, ouch.
And you'll probably experience, well, some classic signs of an upset stomach,
Right.
like pain, burning, bloating, nausea, maybe even vomiting.
So what causes these ulcers to form in the first place?
Two main culprits: a bacterial infection called H. pylori and long-term use of NSAIDs, those common pain relievers like aspirin and ibuprofen.
It's amazing how such a tiny bacterium can cause so much trouble in our stomachs. How does H. pylori even survive in that harsh, acidic environment?
It's a survivor, that's for sure. It actually produces an enzyme called urease,
Okay.
which converts urea into ammonia. And that ammonia, well, it neutralizes the surrounding stomach acid, creating this tiny protective bubble for the bacteria to live in.
It's like building a little fortress in the middle of a war zone.
Exactly.
So say you do have an H. pylori infection. How do you get rid of it?
The key is combination therapy.
Okay.
Hitting it with both antibiotics to kill the bacteria and acid suppressors to make the environment less hospitable.
So a two-pronged attack.
Exactly.
Makes sense. And speaking of acid, this brings us to another common condition.
Oh, yeah.
GERD, or gastroesophageal reflux disease.
Why?
What is it exactly, and how's it different from just occasional heartburn?
We've all had heartburn, right? That burning sensation in your chest. But GERD, that's a chronic condition where stomach acid keeps flowing back up into the esophagus,
Okay.
irritating it and potentially damaging its lining.
Definitely not something to ignore then.
Yeah.
What are the risk factors for developing GERD?
Well, lifestyle choices play a big role here. Things like eating large meals, smoking, too much caffeine or alcohol, they can all weaken the lower esophageal sphincter.
The what?
The lower esophageal sphincter. It's the valve that's supposed to keep stomach acid down in the stomach where it belongs.
Ah, okay. So those late-night pizza binges might not be the best idea.
Moderation is key. But yeah, simple lifestyle changes like eating smaller meals more often, avoiding trigger foods,
Right.
and even staying upright after you eat can make a big difference in managing GERD.
Sometimes the best medicine, IS, just changing our habits.
Absolutely.
But for those times when that's not enough, what medications can help us combat all this excess acid?
We've got a whole arsenal of acid suppressors, each working in a slightly different way. Antacids, H2 blockers, and proton pump inhibitors, or PPIs.
Okay, let's break those down one by one, starting with antacids. They seem pretty straightforward.
Yeah, antacids, they're your quick relief option.
Okay.
They work by neutralizing the acid that's already in your stomach.
Okay.
Think of them as tiny chemical sponges,
Okay.
soaking up all that excess acid.
Yeah.
You've got familiar names like sodium bicarbonate and calcium carbonate in those over-the-counter antacids.
But our notes warn about using them too much. Why is that?
Well, if you overuse antacids, you can get what we call a rebound effect.
Okay.
Your stomach senses that sudden drop in acidity and starts pumping out even more acid to compensate. It's a vicious cycle.
Got it. So antacids are best for occasional use, not a long-term solution. What about H2 blockers? Where do they fit in?
H2 blockers like cimetidine and famotidine, they work a bit differently.
Yeah.
They target the histamine receptors in the stomach. Those are the ones that trigger acid production.
Yeah.
By blocking them, they essentially tell your stomach to chill out and produce less acid.
So it's more about prevention than just neutralizing existing acid.
Exactly. One common one was ranitidine, Zantac.
Yeah.
But you might have heard it was recently recalled because of some potential contaminants.
I do remember hearing about that. What about the H2 blockers that are still available? Are there side effects to watch out for?
They can cause some dizziness, confusion, or some GI upset, but they're generally considered pretty safe.
Good to know. Now let's move on to the big guns, PPIs. Our notes highlight omeprazole, also known as Prilosec.
Right.
These seem to be the go-to for more serious cases of GERD.
They are. PPIs, they're the most potent acid suppressors we have. They shut down those proton pumps in your stomach, the ones responsible for that final step of acid production.
So cutting off the acid at the source.
You got it.
If you need serious acid reduction, PPIs are the way to go.
Exactly. However, there's a reason why PPIs are typically only for short-term use.
Okay, why is that?
Well, long-term use has been linked to some potential risks. Things like an increased chance of infections, even nutritional deficiencies.
Why would blocking stomach acid cause those kinds of problems?
Well, remember, stomach acid isn't all bad.
Right.
It actually helps kill off harmful bacteria that might be in our food.
Oh, right.
And it helps break down food and absorb nutrients. So if you reduce it too much for too long, well, there can be some unintended consequences.
So it's all about finding that balance between effectiveness and the potential long-term risks.
Exactly. And that's why it's so important to follow your doctor's advice when it comes to the dosage and how long you take any of these medications.
That makes sense. We've talked about PPIs and other acid suppressors, but our notes also mention two medications that protect the gut in a different way, sucralfate and misoprostol.
Yes, those are interesting ones.
Mm-hmm.
Sucralfate or carafate, it doesn't actually reduce acid production.
Mm-hmm.
Nope, it forms a protective barrier over those ulcers.
So it's like a bandage for your stomach lining.
Exactly.
Yeah.
Shielding them from the harsh acid and allowing them to heal.
Okay, and it's not really absorbed into the bloodstream, right?
Right, it's mostly excreted in the feces.
Now, misoprostol, also known as Cytotec, that one has a more specific use, right?
Yes, misoprostol is mainly used to prevent ulcers caused by those NSAID pain relievers we talked about.
Right.
It's particularly helpful for people who are at higher risk of complications from ulcers, like older adults or those with a history of ulcers.
Our notes have a pretty serious warning about misoprostol. It can't be used during pregnancy.
Absolutely. Misoprostol can induce labor and potentially even cause uterine rupture. It's crucial for anyone who could become pregnant to use reliable contraception while taking it.
Absolutely. It's a good reminder that medications, even if they're beneficial, can have powerful and sometimes unexpected effects on the body.
I couldn't agree more. And that brings us to another common set of GI issues, constipation and diarrhea.
Two equally unpleasant extremes.
Right. And it all comes back to those disruptions in motility we talked about earlier.
Can you explain how those disruptions actually lead to these conditions?
Think of it this way. Constipation is like sluggish motility. Things are moving too slowly through the digestive tract, so infrequent and difficult bowel movements. Diarrhea, on the other hand, that's like motility on overdrive. Things moving too quickly. Frequent, loose, watery stools.
So it's all about finding the right pace. And I'm guessing this is where medications like laxatives and antidiarrheals come in.
Exactly. We've got a whole bunch of laxatives to get things moving and antidiarrheals to, well, put on the brakes.
Let's start with those laxatives. Judging by these notes, there are a lot of different types.
Oh, yeah, there are. We've got bulk-forming laxatives, saline or osmotic laxatives, stimulant laxatives, and even surfactant laxatives. They all work a little differently, but the goal is the same: relieve constipation.
Our notes focus on senna and psyllium as examples. What can you tell us about those two?
Senna is a stimulant laxative, so it directly stimulates the muscles of the intestines, making them contract and move things along. Psyllium, on the other hand, that's a bulk-forming laxative. It absorbs water in the intestines, making the stool larger and softer, which also encourages things to move.
I've heard about psyllium before. Isn't that what's in Metamucil?
It is. Think of it like adding fiber to your diet. It helps bulk up the stool and makes things flow more smoothly.
Makes sense.
Oh.
But our notes do mention a potential downside to those stimulant laxatives, like senna.
Yeah, there's a risk of dependence with long-term use.
Okay.
Your body could become reliant on them to have a bowel movement.
Meaning your body forgets how to do it on its own.
Exactly. That's why it's always best to use laxatives sparingly and under the guidance of a healthcare professional.
Noted. Now let's switch gears and talk about antidiarrheals. What's the go-to medication for slowing things down?
Loperamide, often sold as Imodium.
Okay.
It's available over the counter, and it's really effective for sudden diarrhea, like traveler's diarrhea.
How does it work? Does it just, like, soak up excess water?
Not quite. Loperamide actually slows down intestinal motility.
Okay.
It tells those overactive intestinal muscles to calm down, giving the intestines more time to absorb water from the stool.
So it's like telling your gut to take a chill pill.
Exactly. And it really works for those sudden, uncomfortable bouts of diarrhea. But like any medication, it does have some potential side effects.
Like what?
The most common are constipation and drowsiness. Not too surprising, considering it's slowing things down in the gut.
True enough. Now, our notes mention another condition, irritable bowel syndrome, or IBS.
Ah, yes.
Can you give us a rundown on what that is?
IBS is a complex and often frustrating condition. It's characterized by abdominal pain and changes in bowel habits. You might have constipation, diarrhea, or both.
Ugh, sounds like a roller coaster you wouldn't want to be on.
You're telling me. While there's no cure for IBS, there are medications that can help manage the symptoms. Our notes specifically mention elocitron or Lotronex.
It's the story with that one.
Elocitron is typically reserved for severe cases of diarrhea-predominant IBS when other treatments haven't worked.
But there's a note here about some potentially serious side effects. What should people be aware of?
You're right. There's a risk of a rare but serious condition called ischemic colitis.
Okay.
That involves reduced blood flow to the colon, which can be very dangerous. So close monitoring is essential for anyone taking elocitron.
Okay. Definitely not a medication to take lightly.
Exactly. Always weigh the potential benefits against the risks with any medication, but especially those with potentially serious side effects.
Good advice. Well, we've covered a lot of ground in this deep dive into the GI system, but we're not done yet. Your notes also delve into medications for nausea and vomiting,
Oh, yeah.
which seems like a fitting topic after all this talk about stomach acid and bowel movements.
Right. While nausea and vomiting can be symptoms of other GI problems, they can also be separate issues triggered by a bunch of things, from motion sickness to migraines to certain medications.
Let's delve into that next time.
Sounds good?
But first, how about we take a moment to recap what we've learned so far?
That's a great idea. We've covered a lot of ground in this deep dive.
We have. We talked about the gastrointestinal system, how it works, and some of the most common issues that can come up, like peptic ulcers, GERD, constipation, and diarrhea. And we've looked at a whole bunch of medications that target those conditions, from antacids to proton pump inhibitors to laxatives.
And next time, we'll explore the world of nausea and vomiting and how medications can help with those symptoms.
So co-connected, right?
It is. Until then, keep those brains churning.
We'll be back soon with more deep dive goodness. All right, so we're back and ready to explore the world of nausea and vomiting.
Ah, yes, a topic we've all experienced at some point, I'm sure.
Definitely not a fun one.
No, not at all. While it can be a sign of something more serious going on in your GI tract, nausea and vomiting can also be their own separate issues.
Right. And it's not something you want to deal with for too long. Our notes mention that uncontrolled vomiting can lead to some pretty serious complications.
Absolutely. It's not just about feeling miserable. You can become dehydrated very quickly, and that can lead to electrolyte imbalances.
Dehydration makes sense, but what exactly are electrolyte imbalances and why are they so concerning?
Well, when you vomit, you're not just losing water, you're also losing essential minerals like sodium, potassium, and chloride. And these electrolytes, they're crucial for a whole bunch of bodily functions.
Like what?
Everything from nerve impulses to muscle contractions to regulating your heartbeat.
Wow, so those imbalances can really mess things up.
They can, and in severe cases, they can even lead to heart rhythm problems.
Okay, definitely not something to take lightly. Now, I have a question that's been bugging me since we started going through these notes. It mentions that inducing vomiting after poisoning, it's generally not recommended.
Yeah.
I always thought that was the standard first aid response.
It's a common misconception, but you're right, it's not usually a good idea. I mean, it might seem logical to try to get the poison out of the system that way, but it can actually do more harm than good.
Really? How so?
Well, for one thing, there's a risk that the vomit could get aspirated into the lungs, and that can lead to some serious respiratory problems.
Makes sense.
And also, certain poisons, like corrosive substances, they can actually cause more damage to the esophagus on the way back up.
So it's like adding insult to injury.
Exactly.
So what should you do if you suspect someone has ingested a poison?
The best thing is to call poison control immediately.
Right.
They can assess the situation, provide guidance based on the specific substance, and even advise on whether inducing vomiting is appropriate or not.
Always best to leave it to the experts.
Hmm.
So let's say you're dealing with nausea and vomiting, but not from poisoning, more from something like motion sickness or a stomach bug. What medications can help ease those symptoms?
Well, we have a whole class of drugs called antiemetics, and they work in a few different ways. Some of them, like ondansetron, also known as Zofran, they block serotonin receptors, which are involved in that vomiting reflex.
Ah.
And others, like metoclopramide or Reglan, they actually speed up stomach emptying and reduce nausea that way.
Our notes highlight ondansetron for its use in chemotherapy-induced nausea and vomiting.
Right.
That must be such a relief for those undergoing cancer treatment, because chemo is known for causing those side effects.
Absolutely. Having effective antiemetics like ondansetron can make a huge difference for those patients.
Okay, now what about metoclopramide? It says here it's used for GERD and something called diabetic gastroparesis.
Yes, diabetic gastroparesis is a condition where the stomach empties too slowly because of nerve damage caused by diabetes.
Okay,
And metoclopramide, it can help speed things up.
interesting. But our notes also mention something about potential movement disorders associated with metoclopramide.
That's right. There's a risk of something called extrapyramidal side effects. These are movement disorders that can affect things like muscle control and coordination.
Why would a medication for nausea and vomiting cause movement problems?
Well, it's because metoclopramide affects the dopamine pathways in the brain, and dopamine, that plays a big role in movement.
Ah, I see. So it's like a trade-off, relieving those uncomfortable GI symptoms, but potentially causing movement issues.
It can be, yes. That's why it's so important to weigh the benefits against the risks and discuss any concerns you might have with your doctor.
Good advice. Well, we've journeyed through the digestive tract, tackling ulcers, GERD, constipation, diarrhea, and even nausea and vomiting. But now, our deep dive takes a bit of a turn. We're heading into the realm of blood clotting.
That's right. It might seem unrelated to the GI system at first glance,
Yeah.
but when you consider that so many medications, including some we've already talked about, can affect blood clotting, well, it starts to make more sense.
Okay, I'm intrigued. But before we get into that, maybe a quick recap for our listeners who might be tuning in for the first time.
Sure.
So far, we've been discussing the gastrointestinal system, its main functions, and some of the common problems that can arise, like peptic ulcers, GERD, constipation, and diarrhea. We've also looked at a variety of medications used to treat these conditions, everything from antacids to proton pump inhibitors to laxatives.
And now we're going to explore the world of blood clotting and how some of these medications, as well as some new ones, can impact this crucial process.
Sounds like things are about to get even more interesting. Let's dive in. All right, blood clotting. I'm ready to learn more about this connection to the GI system.
Great. It all starts with understanding how this whole clotting process works.
Okay, take it away.
So you've got these things called platelets, tiny cell fragments in your blood that are always on patrol, looking for any damage to blood vessels.
Okay.
And when they find a breach, they jump into action, clumping together to plug the hole and stop the bleeding.
Like a SWAT team, first responders patching things up.
Exactly. But they don't work alone. They've got backup in the form of clotting factors. These are
Hmm.
proteins that also circulate in the blood and help to, well, to clot.
Okay.
These factors, they work together in this complex cascade, ultimately forming a stable blood clot that seals the wound for good.
Sounds complicated.
Yeah,
Lots of moving parts.
it is, and it's all about finding that balance, right?
Balance.
Yeah, preventing too much bleeding, but also avoiding those clots that could block blood flow and cause other problems.
Oh, right.
Too much clotting, you risk a stroke or a heart attack. Too little, and even a minor cut could turn into a serious bleeding issue.
So it's like walking a tightrope.
Exactly. And that's where medications come in to help us manage this delicate dance.
I see from these notes that we've got a few different types.
We do anticoagulants to prevent clots from forming, antiplatelets to specifically target those sticky platelets, and even thrombolytics to bust up clots that have already formed.
Wow, a whole arsenal. Let's start with anticoagulants. I see warfarin or Coumadin and heparin mentioned here. What's the difference?
Warfarin is an oral anticoagulant commonly prescribed. It basically interferes with how certain clotting factors are made in the liver, so it slows down that whole clotting process.
Hmm.
Heparin, on the other hand, is usually given by injection, and it acts more directly in the bloodstream to prevent those clots from forming.
Different approaches, but both aiming to thin the blood.
Exactly. Warfarin is often used for long-term clot prevention, like in people with atrial fibrillation or those who've had a DVT or pulmonary embolism. Heparin is more commonly used in hospitals to prevent clots in IV lines or during surgery.
Okay, that makes sense.
Mhm.
Our notes also mention monitoring INR levels for people on warfarin. What's that about?
INR stands for International Normalized Ratio. It's a blood test that measures how long it takes your blood to clot.
Oh,
Regular INR monitoring is super important for people on warfarin just to make sure the dose is right.
right.
We want the blood thin enough to prevent clots, but not so thin that there's a risk of bleeding too easily.
Another balancing act.
Exactly. And with heparin, we usually monitor a different blood test called PTT, or partial thromboplastin time. Again, it's about making sure the dosage is just right.
Got it. What about antiplatelets? They zero in on those sticky platelets, right?
That's right. Antiplatelets, like clopidogrel, often sold as Plavix, they work by preventing those platelets from clumping together and forming clots in the first place. And then, of course, there's good old aspirin.
Aspirin. I thought that was for headaches and fever.
Aspirin is a multitasker. At low doses, it also acts as an antiplatelet.
Oh, wow.
It's often recommended for people at risk of heart attacks or strokes because of this effect.
So it helps prevent those dangerous clots from forming in the arteries.
Exactly.
It's amazing how a common over-the-counter drug can play such a big role in preventing those serious events.
It is. And then we come to the real heavy hitters, the thrombolytics. These are like the clot-busting superheroes of the medication world.
Our notes mention alteplase or Activase. When would you use something like that?
Thrombolytics are reserved for emergency situations.
Okay.
When there's a life-threatening clot, like during a heart attack, stroke, or a pulmonary embolism, they actually dissolve that clot quickly, restoring blood flow to the affected area.
Sounds intense. I imagine there are some pretty serious risks, too.
Definitely. The biggest risk is bleeding. You're basically dissolving a clot, after all. So they're only used in those critical situations where the benefits outweigh the risks.
I understand. Now, we've talked about preventing and dissolving clots. But what about those times when the bleeding just won't stop?
That's where we use hemostatics. These medications help to promote clotting.
Like in hemophilia, where people have a deficiency in clotting factors.
Exactly. Hemophilia is a genetic condition, and the main treatment is replacing those missing clotting factors.
So you're giving the body what it needs to clot properly.
Precisely. There are also hemostatic medications, like minocaproic acid, that work by preventing the breakdown of existing clots.
It's incredible how many different ways there are to manage this whole clotting and bleeding system.
It is. It's a complex system, but a vital one.
Absolutely. Well, we've covered a lot of ground in this deep dive, from the ins and outs of the GI system to medications for ulcers, GERD, constipation, diarrhea, nausea, and now blood clotting disorders.
It's been quite a journey through all these interconnected systems of the human body, and it really shows how important it is to see the bigger picture when it comes to medications.
It definitely does. We've learned so much today, and I hope our listeners are feeling more confident in understanding how these medications work and how they can affect the body. Any final takeaways you want to leave our listeners with?
Absolutely. First and foremost, always, always follow your doctor's instructions when it comes to any medication. Don't be afraid to ask questions. Advocate for yourself and your health.
Right.
Second, be aware of the potential side effects and interactions of any medications you're taking. Knowledge is power.
Absolutely.
And lastly, remember that lifestyle changes can often play a huge role in managing GI health and overall well-being.
Such great advice. I want to leave our listeners with a final thought to ponder. With all the complexities and potential side effects of some of these medications, where do you see the future of GI treatment heading? Will we find even more targeted therapies, ones with fewer side effects? Will personalized medicine become even more important? Tailoring treatments to each individual's unique needs. These are all important questions to think about as we continue to learn more about this amazing and essential system in our bodies.
I agree. The more we understand about the gut and how it works, the better we'll be at developing those safer and more effective treatments for all sorts of conditions. It's an exciting time to be in medicine, that's for sure. So until next time, keep learning, keep asking questions, and keep diving deep.
Thanks for joining us for another deep dive.